Hello, everyone. Arya and I will be presenting on Williams syndrome.
A little background on Williams syndrome. It is a neurodevelopmental disorder that presents at birth due to the microdeletion of genes at chromosome 7. Williams syndrome has multiple names such as Williams-Beuren syndrome, supravalvular aortic stenosis syndrome, and idiopathic hypercalcemia. Some of the characteristics are both presented in cognitive and physical. Some of it include cardiovascular disease, developmental delay, distinctive facial features, connective tissue abnormalities, some behavior deficits, hypersociability, intellectual disability, and so on.
And now, onto the etiology and prevalence of Williams syndrome. It involves the deletion of 25 to 28 genes on chromosome 7, as we previously mentioned, and specifically the elastin gene. And it also can be diagnosed with a blood test. So it affects about 1 in every 75 to 10,000 people in the world, and that is 20 to 30,000 people in the US. And it affects both males and females equally. 100% of the cases involve dysmorphic faces, 90% cognitive profile, 80% have cardiovascular disease, 75 have intellectual disability, 50% with hypertension, and 15 to 45% with idiopathic hypercalcemia.
Now, on to the medical management. Methods of managing Williams syndrome vary depending on the severity of the presenting symptoms. So, for cardiovascular complication, this may reduce life expectancy. 30% of children with SVAS, which is the most common cardiovascular anomaly of Williams syndrome, will require surgical correction, with the cardiac surgery or catheterization having a mortality rate of 6%. Blood pressure should also be monitored regular, considering that the most common Williams syndrome arteriopathy of stenosis and hypertension increases the risk of stroke. Children may also be prescribed with calcium channel blockers, thiazide diuretics, and angiotensin converting enzyme inhibitors, and angiotensin receptor blockers, although these are advised against beta blockers. For symptoms of dehydration, constipation, and muscle cramps that occur with hypercalcemia, adequate water intake should be monitored to ensure daily. Parents should also refrain from providing their children with vitamins and supplements that involves calcium. For constipation, doctors also include osmotic laxative treatments in addition to an increased water and fiber diet. For PT and OT to address uh, visual and motor skill deficits, developmental and intellectual deficits, prevention of contractures, and adaptive methodologies to increase performance in the client's meaningful daily activities. Currently, there is no cure for Williams syndrome, but they do have a normal life expectancy.
Billy, a 5-year-old boy, is diagnosed with Williams syndrome as an infant. Billy has two loving parents and a younger sister who all live in a single story home in LA. Billy loves to spend time with his family and enjoys it when they make meals together, where he often helps to set the table or stir food together using a big spoon. Billy experiences difficulty with manipulating eating utensils and frequently changes his grip to a palmar grasp. Billy also experiences sensory sensitivities, specifically to sound, where if his younger sister cries or his peers become loud in class, he often covers his ears and expresses distress by screaming due to poor sensory and emotional regulation. Billy attends general education kindergarten class, where he has an individualized IEP plan and receives educational support twice a week, with one on one education with an instructor to work on utensil use and writing, and additionally in class during group activities. Billy has a mild intellectual disability as well as is hypersocial, which often leads him to interrupt others while they are speaking. At school, Billy is able to participate in most in class activities, although he often drops his pencil and crayons and has difficulty staying within the coloring lines due to visual, spatial, and fine motor skill deficits, as well as decreased tripod grasp strength. One of Billy's strengths is his skills of expressive communication, which help him to interact with others and express his needs. Billy's parents are really eager to see him more effectively use his utensils during their family mealtime and enjoy the foods they make together. As Billy has more recently started going to school and is still learning to make new friends, he is also experiencing more social pressure to fit in. He wants to be able to draw and write letters like his peers during class and to be able to handle louder activities and environments.
Some of the client's symptoms: Billy has difficulty participating in self feeding activities with utensils due to his fine motor and visual motor integration deficits. The next one is Billy has difficulty drawing and writing letters. This is due to his fine motor and visual motor integration deficits as well. And lastly, Billy has difficulty participating in groups during class. This is due to his sensory sensitivity, poor emotional regulation, few coping strategies, and hypersocial interfering behaviors.
And now here are our goals. One of our short-term goals is Billy will complete feeding activity with 60% accuracy with Mod Eye assistance using built-up handle on spoon and fork within 4 OT sessions. Another is Billy will complete drawing activity, copying shapes up from the board with 90% accuracy using tripod grasp 75% of the time and no more than one verbal cue within 4 OT sessions. And our last short-term goal is Billy will complete 5 minutes of group activity with an adult with no more than one interfering behavior using one sensory strategy and with no more than 2 verbal prompts within 4 OT sessions. And for our interventions, we're starting with a prep method of the obstacle course. The purpose of this is to provide the proprioceptive input for sensory regulation and incorporated fine motor aspects as also a prep method for the following activities. Then we have our first activity of an arts and crafts of making unicorn crowns, and the purpose of this is to practice the tripod grasp, draw shapes, and squeeze a glue bottle in order to increase grip strength for the tripod grasp. The second activity is a feeding activity where we make and share a unicorn cake using mashed potatoes and food dye, and the purpose of this is to practice handling of a spoon and scooping for feeding. And lastly, we end with a social story, which involves unicorn friends sharing their adventures. And this is to practice problem solving, social awareness skills, and to identify self regulation strategies.
For our prep method, we use an obstacle course to address Billy's proprioceptive input and sensory regulation. We use the ASI frame of reference as Billy needs increased proprioceptive input to help him regulate his nervous system so that he is set up for greater success in the next activities in the session. It's important to note that proprioceptive input breaks in the form of crashing into the crash pad were provided as needed throughout the activities. The next activity of art was arts and crafts, which is making unicorn crowns. We use the MCML frame of reference, dynamic developmental frame of reference, and MOHO. For the MCML, Billy is still learning how to position his hands and to apply a tripod grasp instead of frequently switching between inferior grasping patterns. For the dynamic developmental frame of reference, for considering what level of writing and use of grasping patterns Billy may be expected to apply at his age and considering his personal factors and the occupation at hand. For MOHO, this is considering the child's personal experiences and viewpoint of their abilities as well as their occupational identity.
In activity 2, we did a self feeding with utensils activity where we used mashed potatoes and food dye and scooping of a spoon. We used the biomechanical frame of reference because client factors such as strength and coordination are taken into consideration with the occupation of self feeding, including the positioning of the hand and overall handling of eating utensils. In activity 3, which involves social skills and emotional regulation using social stories, we used the cognitive behavioral frame of reference. This is for educating on emotional regulation skills and examples of social etiquette, such as taking turns. And also, it works on the child's behavior and social skills. And evidence has shown that is effective for use with children who have behavioral issues and intellectual disabilities. Here is our intervention video. Please click on the link below to watch it. Thank you for listening to our presentation.
And here are our references. Thank you.